survived lymphoma, heart failure, and is now surviving prostate cancer. See his incredible journey to live a full life despite the hurdles thrown his way. Good morning and welcome back to All Things Heart. I'm Jessica Lovell in for Alexis Del Cid this morning. When most of us go off to college, we hope for a new and exciting adventure. John Hill got that eventually, but it was a much rockier journey than he had anticipated. But he's going strong now thanks to a device called an L-Vad and a whole lot of heart. Alexis Del Cid shows us.
The first thing you notice when you step into 59-year-old John Hill's apartment is a giant knight that looks to be about 8 feet tall, towering over the puzzle board in his living room.
His name is the Tin Man.
John says he's always been fascinated with knights and castles. But the light of his life, his granddaughter, Iris.
I have a couple of toy boxes here, and they're full of her toys. She loves Elmo.
On the day we visit John, Iris is in preschool, but she still has a huge presence in his home.
4 to 6 month mark is when I started watching her. So when I had an appointment with the L-Vad team or the other doctors, she would go along with me.
The L-Vad device he's talking about is what keeps him alive. He's had it since 2018, longer than he's been a grandpa. And his journey to this device begins way back in 1989 when John was a freshman at KU and one of his friends noticed something.
She says, "You've got a lump under your arm." And she said, it's protruding out.
He went to the doctor on campus, who told him he needed to have the lump checked out at a hospital. But John says he didn't have the insurance to afford it, so he waited more than 3 years until he had his first job. By that point, the lump had grown from a ping pong ball to the size of a baseball.
When the test results came back, he said I had cancer, and I didn't hear anything else he said. Everything was just mute, like a ringing in my ears, and that's all I heard.
John had Hodgkin's lymphoma, and the diagnosis kicked off a decades-long battle for survival that has included multiple chemotherapy rounds, 2 bone marrow transplants, and the removal of his spleen.
Tumors can hide in there, so they did that.
Then in 2018,
and I'm like, why am I out of breath? What's going on? I'm like, my asthma's acting up.
It wasn't asthma. John was in heart failure.
Hey, John.
He was immediately referred to the University of Kansas Health System, and John learned he wasn't eligible for a heart transplant because of the lymphoma, but he was eligible for L-Vad surgery. The bag you see here contains a device connected to John's heart by a tube running through his stomach. Years later, John says he's still living with lymphoma, but because of the L-Vad, he's also thriving, making more cherished memories with his granddaughter, and he hopes to check off one big bucket item from his list within the next couple of years.
I would like to see a castle in Europe, and not a rundown castle either.
No rundown castles for John. Two of John's L-Vad coordinators are joining us this morning, Ashley Manning and Annie Medley. John is joining us from his home this morning. John, good morning. How are you?
Good morning. I'm doing pretty good. Thank you.
Good. And ladies, how are you today?
We're good. Thank you.
I bet it's nice to see John. Good. And Miss Iris, you were so sad to see she's growing up right before your eyes, in fact.
I know. We're also sad that she's in preschool because we don't get to see her either.
I know. And how long has it been since you've seen John?
I just saw John last month in the clinic.
Nice. So you guys have quite the relationship. Ashley, how many patients do you have, though, who have lived 7 years on the L-Vad? What is a typical time frame?
So I feel like, every patient is different, and a lot of times we have patients that'll go to transplant, or usually it's some other complication that causes the problem. We probably had maybe 10 to 15 patients that have lived this long with the VAD. And John takes very, very good care of his device and does what he is supposed to. So I think that points to his success as well.
Well, that's good. So he's a good patient.
Very good.
John,
yes.
how are you feeling today?
I'm feeling good. Feeling real good. I was going to go for a walk, but I think it made me rain today.
But that's good. Taking care of your L-Vad, taking care of yourself. Annie, an L-Vad is often called a bridge to transplant. That's what we call that. But John also has cancer. Does he qualify to join the transplant list?
So unfortunately, not at this time. He, when we first evaluated him 7 years ago, he was not free and clear of cancer, and so he was not deemed to be in remission. Therefore, we could not make him a transplant eligible candidate. We at our institution have standards that if patients are cancer-free for a set amount of time and fully cleared of their cancer, we can rediscuss whether they're a transplant candidate, but that just hasn't been a part of John's journey.
Is there an additional risk to getting an L-Vad while undergoing treatment for cancer? I guess that's why that you have to really take those precautions.
Yeah, so we definitely have to keep in mind things like what's their prognosis, what type of cancer do they have, what is this cancer going to do for them, what's their long-term life expectancy, and then it impacts things like healing. Are they going to have trouble healing from an L-Vad surgery? Are they at an increased risk for infection, because infection risk always goes up if your immune system is decreased from cancer drugs.
John, we know you have had quite a journey, as you just shared, a cancer diagnosis, heart failure, an L-Vad, a bone marrow transplant. So I have to ask you, what keeps you motivated?
You know, when I was first diagnosed, or somewhere along the line over the years, when my daughter was born, after I was married, that was the motivation. Her birth and me being there. And she was 6 months old when I had the first bone marrow transplant. Wasn't the first chemo, but the first bone marrow transplant. So that was the motivation, is to be around for her. And then, and now, the new motivation is my granddaughter, being around to be a good grandpa for her.
Yeah, this kind of full circle moment with Iris, it sounds like.
Yeah, yes, it is.
John, have doctors given you a reason for your heart failure?
You know, I was told most likely it was there was one particular type of chemo that I had. And I can't recall the name of it, but I got it written down. But it was just hard on the heart. And when you go through chemotherapy drugs, you know, they tell you the downside, the things that can happen. But, you know, you look at your options. It's like, well, what else am I going to do, you know, if I want to live for the next few years? So most likely one of the chemo drugs that was really harsh on the heart is the reason for it.
I want to talk about this day-to-day living with the L-Vad, because it does require some work on your part, John. And the ladies had mentioned that you do a pretty good job of taking care of it at home. So kind of walk us through that. What does that entail?
You know, it's not a lot of work. I have to make sure that when I shower, to put my L-Vad in a shower bag to protect it against the water. I can't submerge in water. I can't take a bath. It has to always be a shower. So that's the main thing. If it's raining, if it's not raining hard, I can get from the house to the car and I'm okay. But if it's raining hard, I don't get out in the rain like that. Or, you know, having an umbrella protects it against that. So basically, just keeping it free of water. The batteries, when it's time to go to sleep, I have to make sure to change the batteries to full-size batteries. Even though I plug into the wall outlet as I sleep, if the electricity goes out, it needs to have a backup source of power. And so that's the main thing, is those things.
John, I've met a lot of people who've been on the L-Vad, and you know, it's very cumbersome and holds them back in many ways. But you seem to really take it in stride. I mean, you seem like, and I know maybe after being on it for 7 years, you've learned to just, you live with it, and it's kind of just become a part of you. Is that kind of, do you attribute a lot of that to, I guess, your attitude towards the L-Vad? It's just something you've gotten so used to, and it's just a part of your life, and it's kind of easy at this point.
Yes. When I first got it, I was a little paranoid. I felt people were you know, staring at me and wondering what it is. And sometimes I'll ask, I say, hey, what do you think this is? Because I really wanted to know, and I didn't know the answer to that. And after, it's what you just said, after so long of having it, I'm like, I'm okay. This is keeping me alive, And so, uh, and I one time I was with a friend and we were on vacation together. People were staring while we were in a line for the museum. I didn't. I started tuning that out, so I didn't really notice it, but she did. And she said, "Does it bother you that people stare?" I said, I don't even notice it anymore. So I said, "I'm okay. They're just curious."
Yeah, and it's probably an opportunity to educate, and like you said, it's keeping you alive.
Yes, yeah, and it is. You're right. It's an opportunity to educate. I was in the store in line, and a guy he made a joke, and he thought this was a machine for oxygen because I used to be a smoker. I'm like, no, I never smoked. I said this is a heart machine. It keeps my heart pumping. It moves the blood whereas my regular heart can't do that. And he said, "Oh, I'm sorry." And so it was an opportunity, like you said, to educate him because some people assume, and they're incorrect.
Well, and that's nice. He asked and you corrected him, and now he knows. And Ashley and Annie actually brought in an L-Vad here to the studio, so they're going to help kind of educate us with a show and tell, which is really great. So, kind of explain a little bit about what we're looking at.
Yeah. You want to do the internal and I can do the external?
Yeah, so this is one of the pumps. So this is what John has surgically implanted. This piece here sits inside the ventricle. So they take a little piece of the heart out and they put this piece inside the ventricle. And then the blood goes down inside of it, pumps through, and then there's an outflow graft that attaches from here to the aorta. And then the rest of this gets tunneled through the abdominal wall. And there's a piece here that comes out and connects to the controller.
Okay, what else do we have?
Right, so this is a controller, so this end goes over here, and then I'm not gonna plug this thing, so it'll start screaming. Then there are a couple power ports here, and so we have the two batteries, and like John was talking about, at night there's a battery and wall power, and it'll pull from the wall unless, electricity goes out. But during the day, when he's walking around, it has the two batteries. We give patients 6, so they have plenty to switch out, and some patients can go almost a full day without switching their batteries, and then some patients, depending on how long they're up, have to switch them out a little bit more often. But this is kind of what tells that pump what to do.
Do people feel overwhelmed when you lay out this in front of them and say, this is what you're going to now have to go home and take care of? And then how do you have those conversations and make them feel confident going home and taking care of it?
I think patients feel overwhelmed at the size of the pump, thinking, "Oh my gosh, this is going to go inside of my body." That's the
big first
pump.
thing I thought. Yeah. Where does that fit?
And then you hand them the equipment and you show them how heavy it is and how much it weighs, and they say, "Oh my gosh!" And then I have to carry this on top of my body and carry it with me everywhere that I go and when I leave the house. And so it's teaching them before surgery what goes into getting an L-Vad implant, but then it's also teaching them how to go home and be functional and get back to that quality of life that they're looking for.
And actually, John said that he can take it into the shower, but has to have a special bag that has to cover it up.
Yeah, it's like a water-resistant bag that all the equipment just goes into, and it protects it from getting any damage, and it works really well. So there's a lot of things that patients can still do with this device, but like John said, that there are limitations, and it is a lifestyle change. That's something that, when we're educating, we're very cognizant of, because it's, sometimes it's hard to get that really positive attitude, because this is a change. It impacts your whole life. So we kind of have to be like a cheerleader for the patient, for their caregiver, just to help them get used to their new normal.
Sure, and you look at someone like John, who's 7 years in, and again, he's enjoying life, enjoying his granddaughter, and he knows how important this is to keep him alive. But you're right, out of the gate, it could be a tough adjustment.
Yes.
John, what's been the biggest adjustment that you've had to make getting this device?
The biggest adjustment, I think, just carrying around the bag, because I think after you do the heart surgery, I was very tired, and I had a walker at one point, and I felt like I was the only one who had a walker when I would go to cardiac rehab, because nobody else had one. But I'm like, oh well, and I got stronger. And even when I went to the L-Vad clinic, I would see people walk in with their L-Vad, and I'm like, how are you able to walk around and carry that bag carry another bag. So I was at the beginning stages. I was puzzled, but you get stronger as long as you're watching your diet, what you eat, and exercising as much as you well in the way that you can. And things just got easier. But I think the biggest deal was just carrying this strap around it because it's extra weight. That was the biggest hurdle.
I would imagine, sure. John, your cardiologist, Dr. Zubair Shah, could not be with us today, but we know that you both have such a great relationship, and we want to share something that you said about him giving you some homework after you got your L-Vad device.
I like all my doctors, let me say that, but I really bonded with Dr. Shaw. He says, well, what are you going to do? He says, I don't want you to be a couch potato just sitting around. And so I had to come up with a list of things that I would do.
Okay, what's on the list of things that you would do?
I had several things. I wrote them down so I didn't forget. But I wanted to create a YouTube channel for cars. I love the aspect of reviewing cars and the reliability of them. So I did that. A photography class. I took a class. I had joined the movie club for AMC. I went to New York to see a castle that was on my list for a long time, since my daughter was a little girl. It was in Alexandria Bay, New York. So we saw that.
Yes,
Saw Broadway.
I know where that is, John. I've been by that castle. I know exactly where that is.
Yes. On Hart Island. That was.
Yes.
I for years, over a decade, I had wanted to visit that castle, and I finally did. She brought it up to me after I had the surgery. She said, "I think we should visit the castle you've been wanting to see," and it was a great time. We spent almost a week in New York. Saw a Broadway show that was on the list. Saw The Lion King, and and saw the Statue of Liberty from the boat. In the river, so that was nice, and the other ones, it was traveling was another part. It wasn't on my list to travel outside of New York, but I ended up going to. I drove to Albuquerque, New Mexico, and I drove to Tennessee to see my aunt. So I didn't expect to do that. So it's been great. And I know I'm missing something that I didn't write down. I just can't think of what it is.
Okay, if you think about it, just holler out what it is, because very few people make a list and actually check off the list. Ladies, you got to be pretty proud of this guy making the list and doing all the things on the list. I think this is so cool. You mentioned that Dr. Shaw was like not wanting you to be a couch potato. You're definitely not a couch potato. Let's talk about exercise. You mentioned how important it was kind of in that rehab time back then, getting stronger. But what's exercise look like for you now?
You know, the past a few months, I've been a little tired, so I still walk. But what I want to do, I bought a weight barbell at the store to try to do, and it's just 10 pounds. But it's I'm trying to. I want to get in the habit of doing that 3 times a week, and then I want to. One of the things from heart rehab was doing squats. So I want to do that because that was very helpful at the time. So I want to do that again. So I want to walk more, and I want to incorporate those things I just mentioned.
Well, you're also taking medication, John. Are the meds for your heart or for your prostate cancer?
They're for my heart. I was taking one medication for the prostate. I don't take. I have it, but I don't take that anymore.
So, are you more concerned right now about your heart or your prostate, or both? I'm assuming you take care of both really well now.
I'm more concerned about my heart. The prostate is doing much better. The numbers are much lower than what they were. So I'm very happy with that. So the heart, um, I just hope that it can last a number of more years to go.
So do we. Well, we already have some great questions coming in this morning. If you have a question, send it to us on YouTube or Facebook, or you can send those to the All Things Heart email. You can find links to those right there on your screen. Ashley and Annie, when we first spoke to John, he called you the dynamic duo.
It's always been Ashley and Annie. They've been so helpful during the whole process. And if I have a question, I'll call them, and they'll always call back. And they just, this was totally new and intimidating.
What happens when an alarm goes off at John's house? Like, say, in the middle of the night? Is there someone around or available by phone for him to call?
Yep, we have a trained team of L-Vad nurse practitioners that take call 24/7. So weekends, holidays, nights, they have someone that they can reach out to. So we always tell patients when they go home from the hospital, we understand it's new, it's scary, but that they're never truly alone, that they have someone that they can reach out to any time of day or night if they have questions or concerns.
John, I imagine that was panic maybe the first time that happened for you. Do you remember the first time that happened, that first time the alarm went off for you?
Yes, there's two stages to that, two parts. One, when it first went off, I was, not to be gross, but I was using the restroom. And I guess because of, if you're applying pressure, at least at that time for me, the machine was sensitive. And so it beeped. And I had a panic attack. I didn't realize I was having a panic attack until I told my daughter what was going on. And she told me, she said, "You're having a panic attack. It's okay. And, calm yourself." And she was kind of talking me through it. And then I called, of course, Ashley and Annie about what was going on. Fast forward, in the middle of the night, the machine sounded off. And that was a real alarm. The alarm when I was using the restroom, that was a low flow alarm is what that was, which happens every now and then, but it doesn't happen often anymore. But fast forward, I had another alarm, and that was, I needed to change the machine. I needed to change the controller from the machine I was hooked up to the backup controller. So I called the L-Vad line, and now it was a little frustrating because the person who was the contact, it was her first day as being a contact for the L-Vad, and I think it was a nurse practitioner. She was very nice, but she wanted to make a call before she walked me through it. But it was very scary. Even though you're trained on what to do, you panic inside and you freeze a little bit. So I'm glad that there's the rules about making a call to the office so they can go over it with you. And we changed, because I was like, okay, if you got to wait for the doctor to call you, I don't have much time. I'm just going to go ahead and do it. But we both of us together got through it, and it worked out.
Good. Yeah, because that would be scary, hearing that first alarm. I'm sure he's used to it by now. You have had this L-Vad, John, longer than your adorable granddaughter Iris has been alive. In fact, she, as you had mentioned, has joined you on some of your L-Vad appointments. The ladies here have watched her grow up. What has this bond meant to you?
Oh, it's been great. When I first met her, I fell in love with her, and I was, I don't know, it's just, I don't know, it's hard to put into words. It's just been great. It just, anything she wants, I will get that I'm able to. Yeah, it's just been awesome. And even when she goes to when she went to the appointments with me, it was nice because when she stopped, the check-in staff was asking me where little Iris was. The nurses, Annie and Ashley, were asking me where Iris was. So it was cute. And I'm glad that it was a baby-friendly environment. So that helped. But it's just been awesome because going through having a health issue, and then having a little person that can take your mind off of it, it means the world.
Oh, I'm sure. And later on down the road, I'm sure Iris is going to look back and go, I got to go through all this with my grandpa. And that's going to mean a ton to her too. That's going to be very, very cool. I want to get to some questions from our viewers this morning. Vera has a good question. Wants to know, John, if you are on the electric company's emergency list for power outages.
Yes. I think I think it was Annie that made the contact with the power company for me. But yes, I am. Which basically means if the power goes out, where I live should be higher on the list to reactivate the power because of my heart machine.
You walk patients through that?
Yep. So whenever a patient gets implanted with their L-Vad, we get all of their community contact information. We learn where they live so that we can send information to their local EMS, their local electric company. We want to notify them that there's a patient living in their area that requires electricity for this life-sustaining device. And it typically more or less means that they have to notify you if there's a planned outage so that you can make accommodations. Doesn't unfortunately mean that if you don't pay your bill that they won't shut you off. But
good to know. Kim wants to know, how long do the batteries last? Ashley, I think you had mentioned that earlier.
Yeah, so for this device, the batteries last anywhere from about, like the set of them, like 10 to 14 hours. John, how about how long do you get?
Yeah, I get about 15 on mine.
Oh, nice. Good.
Yeah. I noticed that one set will last longer than another set, but one set does last 15 hours. Yeah, because I get up at around 10:30 typically, and I go to bed at 1:30, and I'll probably have 30 minutes left on there. So it lasts a pretty long time.
Derek wants to know, can you replace John's L-Vad with a new L-Vad if it starts to wear down? Is this something that wears down, or do you just replace battery in different parts?
We typically just replace the batteries and the external components of it. It's kind of a case-by-case basis whether or not a patient's eligible for a VAD replacement should their pump quit or malfunction for some reason. So every patient is different. It's not a one-size-fits-all that we just replace everyone's. There are a lot of things that we have to take into account, whether or not the surgical risk outweighs the benefit. If patients want to go through another surgery, it's a big operation and it's not just a walk in the park. So we have to take it kind of patient by patient to determine if we'll proceed with that.
Marie has a question, John, for you. Was it hard to babysit or care for your granddaughter with your L-Vad? And did she ever pull on it and play with it? And how did you kind of help her understand what it was all about?
You know, when I first, it wasn't hard. As far as tugging on the cord, at times she did, and I would just tell her, because she was, under the age of 2, so I couldn't really say a lot except, no, don't do that, and that would hurt Grandpa. But she does pretty good because I see her on Tuesdays now, and sometimes I'll babysit if her parents are going to a function. But Tuesday after she comes from school, I go to sit with her and we play hide and seek in a video game on the tablet or the phone, and she does pretty good. Now sometimes she typically sits on my right side because my cord, everything is on the left side. But if she's for some reason sitting on the left side, her mom is really in tune with how she's sitting, and her mom will, before I could say anything, her mom kind of jumps in action and tells her not to sit on Grandpa's cord. But she does pretty good. I mean, she's a kid, but she does pretty good.
Hey, John, I just want to say thank you so much for being with us this morning and just being so open and sharing your story and kind of taking us inside your life and sharing these pictures of your granddaughter with us. It's been just so great having you. What do you want the audience to know just about your story? What are your final thoughts today?
I would say not to be afraid of having an L-Vad, even if it's, having it for life, and they can't get a heart. Like my situation, um, it's at first it's a little intimidating, but and it takes getting used to, because you have to wear this all the time, but you get used to it, it's helping you to be able to move around, to breathe. So I would just say, don't be afraid of that. I have a friend I used to work with, or he wasn't a friend, he was an associate. And a friend of mine told me that he was offered an L-Vad, and he turned it down. He's older than I am as well, and he refused to take it. And then in a matter of a few months, he was gone. He's gone. So I say this is a really good technology that they created, and I'm blessed to have it. And I had to meet with about 30 people before I even had the surgery, so they could vote together to see if I would be a good candidate for it. And having good nurses like Ashley and Annie, it makes it easy too. And I'm so blessed that they're still with the department. So I'm very happy about that.
Well, John, thank you so much. Great story, and you've educated us all very well this morning. So again, we really appreciate you. Annie, what do you want to leave everyone with this morning? What's the big kind of takeaway?
I think just John's story. John's the reason that we do this. He's the reason that we do this work. Being able to see patients get back to the quality of life and getting back to the things that they enjoy is the whole reason that we do this work. And then, John, if you ever want to bring Iris back, we would love to see her again.
Yes, I think that's happening. Ashley?
No, I agree. This, like, just seeing John's life and seeing pictures when he was younger, and the extra time that he got, and he got to spend time with his family. He got to meet his granddaughter, and it's just amazing that this device can do that. And it's just nice to know that people like John are going to get to stick around. And so I'm really proud to work with this.
Well, thanks for the work you're doing with these patients and the bond and the connection you're making with them. It's very cool to see. So thank you all for being with us today. And if you would like to watch or share one of our previous episodes, you can scan the QR code to find a list of all of our shows. Next week on All Things Heart, the connection between your pelvic area and your heart, and the procedure to fix pelvic congestion syndrome that gave one woman her life back. That's Thursday at 8. Coming up tomorrow on the Morning Medical Update. Prostate cancer is one of the most common cancers among men, but there are more treatment options than ever before. From radiation to active surveillance, patients have choices. I'm Jessica Lovell on the next Morning Medical Update. This patient chose surgery at the University of Kansas Cancer Center. Hear why and what happened next, Friday at 8.
Actually, John, if you want to hang on for 1 second, if you have time, Ashley and Annie will say goodbye. We just got to shut everything down.